The airway lining swells and produces mucus, and the muscles around the airways squeeze. See how they're squeezed? Making it difficult to breathe. You want to take that?
So the tight muscles there.
And that's an airway without asthma. So it's just like it's harder to breathe when your nose is blocked from a cold. Does that make sense?
Mm-hmm.
Great. So this causes Tom to cough and wheeze and feel like his chest is tight.
But how can we stop that from happening?
Well, 2 different types of medication will help manage Tom's asthma. The first type is what we call a reliever, which relaxes the muscles in the airways. It'll help make Tom feel better straight away.
That'd be good, won't it?
Now, you only need to use this when you have symptoms of asthma like cough, wheeze, shortness of breath or chest tightness.
Mm-hmm.
All right. Now, the most important medication to control asthma symptoms in the longer term is a preventer medication. Now, this is an inhaled corticosteroid and helps control the underlying airway inflammation, which causes asthma symptoms. Now, Tom, you won't feel any immediate effects of the preventer, but you're going to need to take it every single day for it to work, even when you're feeling well.
Why?
Because it'll make it easier for you to breathe. Okay? Now, as Tom's lungs become less sensitive, he shouldn't need to use the reliever as often.
Good.
And the goal is that with good asthma control, the reliever is rarely needed.
It helps to give patients, even young patients, a brief overview of what asthma is and how the prescribed medications work. Then the family can better understand why the medications need to be taken every day, enhancing the likelihood of better adherence with treatment.
Okay, I understand he uses the preventer every day, but how often should he use the reliever?
Well, the reliever is just for when he has asthma symptoms, and hopefully once the asthma is better controlled, it won't be every day. Now, if he does need it every day, we may need to review the management plan. Okay? So the plan is always to keep Tom's asthma as well controlled as possible using the least amount of medication. How does that sound?
Good.
Dr. Chan makes it clear to the Ryans that the preventer medication is very important, even though it doesn't provide the immediate sense of relief as with reliever medications. She also gives the family criteria to know when the asthma plan isn't working.
All right, so let's write down the management plan before we forget it. And I think it'll help you with day-to-day medicines and to know what to do in an emergency. To begin with, he should take 2 puffs of the preventer medication twice a day, every day.
You remember that? 2 puffs.
In addition, in case he has asthma symptoms, I'm prescribing a reliever medication.
Mm-hmm.
Now, within a week or so, I'd expect the night waking to stop.
That'd be good, won't it?
He shouldn't need the reliever often after that. Now, it is very important that he continue taking the preventer medication every day just to keep the asthma under control. Tom, it's going to be a bit difficult to control your asthma if you don't take your medication every day, okay?
The asthma management plan shows how much medication should be used on a day-to-day basis, as well as how to identify symptoms of worsening asthma and how to manage asthma emergencies. Patients need to know how to respond to changing symptoms and how to make adjustments to the medical regimen. To help the family, Dr. Chan outlines the steps the family should take. Dr. Chan walks the family through the plan, making sure it's thoroughly understood.
So now let's talk about how Tom's going to take the medication. I think as he's a bit young to be using the puffer directly to the mouth, he's going to need to use a spacer. This delivers the medication to the lower airways. So this is a spacer.
Right.
And puffer. It does take a little while for children and families to get the hang of it, but I'll show you how. I'll take this one. All right. So just shake the device well. That's right. Place it in the hole.
There.
That's right. Press once and that's right. Breathe in slowly. 1, 2, 3, 4 and out. 1, 2, 3, 4.
And again.
In, 1,
Breathe.
2, 3, 4
Then out.
and out. 1, 2, 3, 4. Excellent. Very good, Tom. That was very good.
Dr. Chan prescribes a metered dose inhaler and a spacer for delivery of these inhaled medications. It's very important to demonstrate all devices and give thorough instructions for their use. This instruction should always be followed by the patient rehearsing their inhaler technique in front of the doctor before leaving the consulting room. Studies have shown that with such education, patients are more able to use devices correctly to achieve better asthma control. It is also essential to give the family written instructions to take home.
All right, so what was the short-term goal for Tom?
To be able to sleep through the night without asthma.
Good. So that's what we want to accomplish before your next visit. And when you come again, we'll review how things went and we can talk further about the medication. So please remember any questions and we'll discuss them for next time. How does that sound?
Sounds good. What do you think, Tom? Good? Okay. Thank you.
To sum up, in the first consultation, Dr. Chan delivered these very important messages to the patient. In this second consultation, Dr. Chan will review the outcome of the previous visit and see whether the family has followed the management plan. She will review why the medications are needed, their safety, and the goals and criteria of successful treatment. These explanations will help the family to see the importance of following the regimen and improve the likelihood of better adherence.
So since the last time I saw you, how's your asthma been, Tom?
Good.
Much better, yeah?
Oh, good. And how's Tom been sleeping? Any coughing or wheezing problems?
No, he hasn't coughed at all since he's been on the medication. It's amazing. It's like he's a different child.
Oh. Well, it sounds like the management plan's working. Do you have it with you?
Yeah. There we go.
Thank you. And do you have any problems or do you have any concerns?
Well, the preventer certainly seems to be working, but I'm really concerned about him being on medication. I mean, how long is he going to have to take all this? Is he always going to be on medicine?
Well, look, we really don't know how asthma will affect Tom over time. Many children who have asthma have less of a problem as they get older, but others continue to have some degree of asthma throughout their lives. Look, at this stage, it is hard to predict what Tom's future will be in terms of asthma.
So he's always going to have asthma and can't be cured?
Well, there is no cure now, but there are excellent medications, and who knows what medical science will bring in the future. Look, as I said before, the majority of children who have asthma don't continue to have it as they get older. And look, what we do know right now is that the management plan looks like it's working. Okay, and as you've indicated, he's no longer coughing and wheezing at night. And this is the result of the medication, so it's good news. It may be in time that less medication is required.
Well, how will we know when that will be?
Well, remember the game plan, yeah? When Tom shows no symptoms for 3 to 4 months, even when he's physically active or has a cold, then we know that we're getting there.
Many parents are concerned about their children taking medications every day for a sustained period of time. It's a good idea to discuss this concern with the family, even if they don't bring it up on their own. It's also important that Dr. Chan reinforces the idea that she and the family share the same goal, that the child be symptom-free with the minimum amount of medication necessary, even during physical activity or a cold. Parents need to be reassured that this goal is achievable.
All right, well, let's stick to this management plan for 3 months. There you go. And we'll see how we go.
Well,
You seem worried about something.
yeah, I'm really
still.
concerned about these steroids. I was talking to a friend last week and he said he'd heard that steroids were very dangerous, especially for children.
Okay, what exactly did he say?
He said it makes you puffy and swollen. Well, don't athletes take them to build up muscle?
Oh, look, I am glad that you brought this up. The steroids that we use for asthma are a completely different type of steroid. They're called corticosteroids rather than the anabolic muscle-building steroids which athletes sometimes misuse. And as they're inhaled directly to the lungs, we can take very low doses so they don't cause serious side effects. Now, on the other hand, not taking the medication could present a very serious problem for Tom. Now I've got some information on the medications here if you're interested in reading them.
Yeah, I would. Thank you.
Now even though they're safe, we still aim for the lowest dose, okay? And when he's symptom free for a few months and he can get through colds with minimal symptoms, then we'll try decreasing the medication. How does that sound?
That'd be good.
Okay.
Most parents are concerned about their children taking medications, especially corticosteroids. Often, the only knowledge they have of steroids is what they hear from friends or family. It's important to reassure families that inhaled steroids are generally quite safe. Dr. Chan takes the time to answer Mrs. Ryan's questions about the corticosteroid medication and addresses her concerns. Research has shown that patients often follow a friend's medical advice, even over their own doctor's recommendations. By taking the time and effort to listen to Mrs. Ryan's concerns, and then thoroughly addressing them, Dr. Chan makes the patient more comfortable with the medical advice, which is more likely to be followed.
Okay, Charlotte. Well, if I remember correctly, our long-term goal was for you to be able to participate better in sport. So how's it been now that you're on your medication?
It's been great, much better. I can play a whole game without any coughing or wheezing.
Okay, great. And how about you, Mrs. Travers? Has she improved?
Oh, she's clearly so much better. It's great. But she's still using the reliever before sport. Is that okay?
Oh, yes. In fact, that's exactly what we want you to do, Charlotte. And in a moment, you can actually show me how you use your medication, all right? Now, do you happen to know that there are lots of sporting champions who have asthma? In fact, with good asthma control, people can even win Olympic gold medals. So how about you? Any dreams for Olympic gold?
Maybe if I can stick with it.
Good. Look, asthma shouldn't stop you from doing what you want to do, all right? Now, I'd like to see you back in about another month's time, and we'll just check that everything's going okay. But if anything should change, I want you to get back in touch with me earlier, okay?
Okay.
Okay.
Thanks so much, Dr. Campbell. We really appreciate it.
It's my pleasure.
Dr. Campbell outlines what the family should expect from asthma treatment. He reassures them that asthma shouldn't disturb sleep or restrict sporting activities. Families need to know that they shouldn't settle for living with symptoms of asthma that can actually be treated. The doctor also introduces the idea that high levels of physical achievement are possible by mentioning people with asthma who have excelled. These men and women serve as positive role models. In this visit, a number of important messages have been delivered.
You were right to call after Tom's recent wheezing at school. Can you tell me what happened?
Well, you know, Tom was doing so much better before he had that cold that stirred up his asthma.
Mm-hmm.
I'm glad he knew to sit down and take his reliever immediately. You know, I'm sure he would have been fine, but his teacher got worried and sent him home early.
Okay. Tom, it sounds like you managed this well. Well done. Now we should talk about asthma management at school. It's only necessary to keep Tom home from school or send him home if he's coughing or wheezing badly and the reliever isn't working. If he just has a stuffy nose and mild wheezing, which goes away after using the reliever, then he's fine to go to school.
Right.
Okay. Have you informed his teachers or the school about his asthma?
Oh no, should I?
Yes. We should make sure that all his teachers in the school know how they can help him and how he uses his medicines. Now, teachers also need to know that Tom's asthma can be controlled with medication and that he should be allowed to be active like the rest of the kids. I might get you to ask the school for the student asthma record and I'll fill this in for Tom next time you come in.
Oh, that'd be good.
Teachers with a student who has asthma should be informed about his or her condition and management plan. Many schools require students with asthma to complete a student asthma record. A standardised form is available from the National Asthma Friendly Schools Programme or your state asthma foundation to inform schools what to do in an emergency. Other educational materials targeted at school personnel may be available from your local health service.
Tom, what do you think made you start wheezing when you were at school?
I don't know, maybe because I was running around a lot with my friends.
Okay. Well, many people who have asthma cough and wheeze with exercise. And this can usually be prevented by taking 2 puffs of the reliever medication just before exercise or gym.
Beforehand?
Yes.
Okay.
Now, I'll write this down in your management plan. Do you have it here?
I do.
And this will be for your school, and so that Tom's teachers know that it's okay for him to take medication before sport.
Okay.
All right, now Tom, you know what to do if you have an asthma attack, if you're at school or if you're at your friend's house or if mum and dad aren't around, right?
Take my blue puffer.
Right, anything else?
Sit down and tell an adult.
Now you know how to call mum if she's at work if you need to?
Yeah, he has my number in all his notebooks, and I'll speak to his teacher about the asthma. She always knows how to reach me.
Oh, good. All right, well I think we're all set for now. I'd like to see Tom again in 3 months' time and see how he's going. Now remember, the goal is no asthma symptoms.
No symptoms. That's our
Right?
goal. Yes. Thanks so much, Dr. Chan.
Dr. Chan will continue to educate her patients and reinforce important ideas. She'll always try to keep the family focused on the primary goal. No symptoms, even with a cold or when physically active. Yet, while Dr. Chan's counselling touches on important asthma topics, given the time constraints of her busy practice, it's not always possible to cover all the issues within 1 or 2 visits. In the 3rd consultation, Dr. Chan has delivered these important messages to the family.
By communicating effectively with patients and delivering these key educational messages, you can significantly increase your patients' ability and motivation to control their asthma and live an active, unrestricted life.